I am Ali Ghanem. I'm a plastic surgeon based in the United Kingdom. I'm also a clinical senior lecturer at Barts and the London School of Medicine and Dentistry. I have established this clinic a year ago in order to bring the state-of-the-art scientific advances and innovations and technologies to everyday problems we face in plastic and reconstructive and aesthetic surgery. My patients come usually from a variety of backgrounds. Some are related to congenital anomalies, some related to aesthetic problems, and some related to scars after other surgeries such as cancer or atrophic trauma, etc. My area of expertise in regenerative medicine and regenerative surgery, and I have a special interest in facial deformities and facial aesthetics. I have engaged with jet volumizing remodeling and regeneration technology, the Energet system, for many reasons. As a plastic surgeons, we have certain solutions that really don't have an answer. One of them is scarring, and especially in relation to hypertrophic scarring. For that, mostly the surgical intervention would require a second operation with probable improvement but unpredictable a secondary scar. Where in this innovative technology, we are able to create a microscopic trauma that will utilize the body's own healing and remodeling potential to the best in a very non-invasive and little taxing way to the patients. I have used the Energet in new areas such as horizontal neckline, some static lines that are not easily addressed with conventional resurfacing or dermal fillers. And I found that the remodeling of the dermis and the improved characteristics of the skin are unparalleled with any other technologies. I have acquired the Energet system last year, exactly 10 months ago. That has been enough for me to see the cycle of dermal remodeling in many indications, mostly around facial scarring, both post-traumatic and acne scarring, as well as post-surgical intervention scarring. I have to say that the remodeling of the scars has been most remarkable, but also the thickening of the dermis in the periorbital area and in the neck areas, and also in areas where usual dermal fillers have failed to yield optimum results. As a plastic surgeons, we have observed that patients, for example, who come with partial thickness burns, they have much better skin properties of the area that has been injured compared to the uninjured area after the healing process is complete. That's because when we have an injury, the body's own repair and regeneration system that is facilitated by the stem cells is activated. And in the process of repairing, there is usually favorable regeneration. The jet volumizing remodeling and regeneration (JVR) technology utilize this very concept of using the body's own regenerative potential through creating microscopic trauma in the dermis, collagen, and elastin fibers that will then lead to a favorable outcome when the microscopic injury is repaired and regenerated. This concept can be used for scars, can be used for rejuvenation of the skin, as well as a needleless drug delivery system. We can use mesotherapy, antioxidants, for example, or recombinant growth factors, or botulinum toxin, or steroids to treat areas in a very high precision as well as in efficacious manner. So far, the main treatments that I have used the Energet for has been really about scar remodeling. I have seen it extremely useful in acne scars, not only on the face, but also on the back. I have tried to address these problems with traditional subcision and filling with fat or some other synthetic fillers to some but limited degree of improvement. With some of the cases that I have treated, I have seen remarkable results happening with very little downtime. The precision, both in 2D and 3D, the thickness and the distribution of the scar possible with this technology is remarkable. Another area that I have used the Energet in has been as a dermis remodeling and thickening tool. I have seen great results in the horizontal neckline, in also some dynamic lines that I cannot treat with botulinum toxin, as well as in a very mild but remarkable contraction along certain lifting desirable vectors such as the eyebrow and the jawline. So having used this technology for almost a year and having been the first in the UK to engage with this technology, I think I'm very privileged in this position. And I think and reflect on this year, and I would be very happy to go back again and use it now from the beginning more confidently, mainly because I have seen quite a transformation in some of these patients that I have treated, especially the scar patients, the acne scars and the traumatic scars. I think the dermal remodeling will be an immensely promising potential for this treatment, and I am looking forward the further follow-up of my patients when I treat this. However, with patients who had really difficult tethered scars, the transformation, the functional and the aesthetic outcome that I've seen in them would make me very encouraged and very happy to use this again and again in such patients.